Now we move to health, where World Obesity Day 2024's theme is focusing on obesity and youth, as it seeks young people to catalyze change. Now, the Lancet has published a report that over 1 billion people globally are currently considered obese, which poses serious health hazards. The study revealed a worrying trend, with obesity rates among adults more than doubling since 1990 and quadrupling among children and adolescents aged 5 to 19. Obesity is defined by the World Health Organization as abnormal or excessive fat buildup in people whose body mass index is greater than 25. Surprisingly, even in low and middle income nations, obesity has overtaken underweight as the most common problem. Now joining us on the news is Dr. Chinasa Amadi, board-certified lifestyle medicine physician, to discuss this. Hello, doctor. Thank you so much for joining me this afternoon.
Thank you so much for having me.
All right, so doctor, in light of the 2024 World Obesity Day theme, which is Let's Talk About Obesity, what are some key areas that we should be focusing on when discussing obesity in our communities?
So one of the key things is education among children. We're seeing, just like you mentioned earlier, we're seeing a rise in obesity among children, and this is a discussion we should be having. We should be having discussions around the consequences, the causes and consequences of obesity as it impacts health of the people, health of people in our communities. These are key discussions that we should be having, promoting understanding around obesity, how it impacts health, how it impacts the economy, how it impacts the social state of the nation, of the people. We should be having such conversations.
All right. Now, still talking on the theme that let's talk about obesity and it's open-ended. Now, beyond individual dietary and lifestyle changes, what are some broader societal strategies and initiatives that can be implemented to address the challenges of obesity?
We can start intentionally having education and creating awareness around this condition. And, this education should be, emphasized, it should emphasize the causes of obesity. We should also, talking about access to healthy foods, affordability of healthy foods. And this is where also food security comes in. We should also be talking about policies around media and body image and health, media and advertising around unhealthy foods, especially foods that are promoted to children. There should be media regulation around that. Those are things that can influence, discussions we should be having on a community level that will go beyond just individuals.
All right, now speaking of influence, now as a lifestyle medicine physician that you are, what are some common misconceptions about obesity that you encounter, and how can we effectively address them during discussions about this particular topic?
So one of the misconceptions that obese people don't have willpower or they eat a lot. It's important to know that obesity is a multifactorial condition. So it's beyond just not eating a lot of food and not exercising. It's beyond that. It could have there are genetic factors, there are social factors, socioeconomic factors, behavioral factors, mental health factors that are implicated in obesity. So that misconception is not real, and it's important that education around these other factors that influence obesity should be had. Some other misconceptions are, calorie in versus calorie out. If I have 500 calories of apple and 500 calories of beans porridge, or 500 calories of small chops, for example, is the same. No, it's not the same. It's because we focus so much on calories, I'm just having small calories, we're not focusing on the quality of calories. So it doesn't equal, it's not just about all calories are equal or it's just calorie in versus calorie out. The focus should be on the quality of the calories. Nutrient-dense foods are not the same with nutrient-less foods, ultra-processed foods. Even if they have the same calories, it's important to know that their impact on your health and on obesity is different. So these are some misconceptions that we should be educating around.
That's quite a misconception, but thank you.
Sorry, one of the misconceptions is the fact that because everybody is obese in my family, I am meant to be obese.
Okay.
It doesn't have to be that way.
Okay. Well, thank you for clarifying that for us, Doctor. Now, let's talk about individuals who are struggling with their weight. What resources and tools would you recommend to help them navigate their journey towards a healthier lifestyle? You know, particularly considering the potential influence of social media and lots of good food and also conflicting information online?
So first things first is to pretty much change your mindset about short-term fixes. Various diets, short diets that claim to be magical, they come up and they are, marketed as the solution to obesity. It's important to know that obesity and weight management is a long-term journey. So the mindset of, I want to lose the weight in the next 1 week. You ask yourself, did you gain it in 1 week? You didn't. So changing your mindset about how you want to lose weight is the first step. How and why you want to lose weight is the first step in obesity management. So, and don't fall for diets, short-term diets. They'll tell you, oh, this will burn the fat. This liquid will burn the fat. Nothing is burning, no fat. You're just increasing the pocket size of the producer, and it's important not to jeopardize your health. It's also important to know that the goal of weight loss in obese individuals is not just to fit into a slimmer casket, it's to be healthier. So that mindset is important, that you can lose weight and you are not healthier. It's important that as you're fighting obesity, your goal is to improve your health, your heart health, metabolic health, and all that. And then seek help from experts. There are experts, dietitians, nutritionists, lifestyle medicine professionals that are there to help you. It's also important to work with your health professionals, your doctor, to guide you on the medical side of weight management.
Okay. Well, quite an insightful conversation we've had. Thank you so much, Dr. Amadi, for joining me to speak on this.
Thank you so much for having me.